All right, so when we talk about the adductors are extremely important because they give us insight into how our pelvic floor is firing. So I want to show you how you can assess your adductors to see how they are performing. So first thing is you want to just check and feel to see if your adductors are tight or if you have some knots in your adductors. Sometimes those knots and tightness can actually be the cause of pubic pain. So what you're going to do is you're going to squeeze your adductors between your fingers, and you'll start up by your pubic bone, and you will just grab and move all the way down towards your knee. So you might find some sore areas or some strappiness of those muscles, and you'll do it on the other side. Sometimes I like to just kind of run my fingers along my adductors to see if there's any sore spots or knots. If you do find a knot or a sore spot, you can just hold some pressure on it and try to work some of those knots out. Very similar to if you were to have a massage and they work on this crazy knot that everyone gets in their upper trap. You'll do the same thing down into your adductors. So next, what you'll do to assess your adductors, you'll grab something to squeeze in between your knees. So I have a towel here that I'm going to use, and you'll be on your back for this. So you'll just put that towel in between your knees, and you are simply going to just squeeze the towel and just see what you feel. Do you feel like the right is squeezing the same as the left? Do you feel like one's quivering more than the other? Do you have pain anywhere? So just take a mental assessment of what it is that you feel. So something else too to check for, are you overusing your hip flexors or your butt when you're trying to do this? That sometimes will just let you know that you have some weakness in your adductors and you're using all the other muscles to try to compensate. So the other way that you can assess your adductors is you'll roll onto your side, and you are going to squeeze only the top leg down into the towel. Again, just checking to make sure your hip flexors aren't firing, making sure you're not really kicking in your glutes when you're doing this, and see if you feel if it's different from the other position. Sometimes muscles work really well in some positions, and other times you have to wake them up in a different position. So then you'll flip onto the other side and feel what your adductor is doing on that side. You can use that positioning and assessment as an exercise too. For your adductors, if you do find that one of them or both of them are weak, you can just simply put a towel in between your knees and squeeze your adductors, holding for a couple seconds, then relaxing and repeating that 10 times on each side or together if you're on your back. And then check out the adductor slide exercise too. That's a great exercise to get those adductors firing.